Right, good morning, everybody. Welcome to the seminar this morning, and good morning and welcome to everybody online. Lovely to have you with us, so thank you, and thanks everyone for making the time to be with us here this morning. Before I go any further, I'd just like to acknowledge that we're on the lands of the Yagara and Turrbal peoples. Acknowledge their ongoing and continuous connection to the lands where we are this morning, and particularly appreciate their warmth in allowing us to be on their country this morning, and pay our tributes and our respects to their elders, past, present and future. And I'd also like to particularly acknowledge any of our Aboriginal and Torres Strait Islander colleagues who are with us either in person this morning or who are with us online. So it's absolutely fantastic to have Dallas Leon come and talk to us this morning. Dallas has had years of experience working in Aboriginal health. I'd be surprised if anybody here doesn't know Dallas either personally or by reputation. He's had a lot of history working in, I think it was Gidgee, Dallas.
Yeah, Gidgee Hilly.
Yeah, as a CEO there.
With Mary.
Right, okay. And now the Director of Commercial Operations at IUE, right? Yep. So it's a real, he's a very busy man. It's a real honour to have Dallas with us this morning. So without further ado, I'll hand over to you.
Thanks. Great, thanks. Firstly, I'd also like to acknowledge country and pay respects to the traditional owners of the land that we're meeting on. Pay respects to elders past, present, and emerging. My name's Dallas Leon. I work with IUE. A little bit about myself. I'm a Calcutta Wanya man, so born in Mount Isa, northwest Queensland. That's where my father's country is. I was just talking to Mary before that. Worked in Aboriginal and Torres Strait Health in Queensland for about 26 years now. So my first job was as a health worker in Roma in southwest Queensland. So as a men's health worker, that was my first sort of entry into Aboriginal and Torres Strait Islander health. And from there, I've worked in various roles with the peak body, Quake, Queensland Aboriginal Health Council, as CEO of a member service in Mount Isa, which is my hometown, which was a great privilege to be a CEO of that hometown, but also worked with the Townsville Hospital Health Service as executive director for Aboriginal and Torres Strait Islander Health for the region, including Palm Island and further out west, and find myself now with IUE as the director of commercial operations, but essentially director of Deadly Choices. Just wanted to put this slide up and acknowledging the work of many elders, including Auntie Mary, and the work that Auntie Pam and Uncle Tiger Bales have done in terms of, this is a mural that we've got at the back of our building. It sort of keeps us grounded and reflecting of where we've come from, why we do the work we do. Certainly, it started many years ago with the hard work of some significant people. Today, I'm just going to talk a little bit about Deadly Choices in terms of some of the programs that we run and so the performance insights. Talk about our community and sporting partnerships. It's fairly, we think a fairly unique model in terms of how we partner with sporting entities and other partners. Talk about our ambassadors, their campaigns, and a little bit of an insight into the future. Look, I'm not going to talk about the why, but we know that there's a high burden of chronic disease. We know that for a very long time. There's disparities in terms of life expectancy. Clearly, chronic disease is one of the biggest drivers for that. And as a Aboriginal community controlled entity, focuses on primary care. That's right up our alley in terms of trying to address the issues around chronic disease. And we know that most of those are preventable when we look at the burden of disease. But I think most importantly is that bottom dot point, and apologise about the layout of the slides. It can sometimes make it a bit hard to read, but this is our way of using health promotion and engaging community in health systems. It's not a westernised model. This is Deadly Choices is fairly and squarely a community program that was devised and designed by community. And I think it's a really great example of how we can do it under an Aboriginal and Torres Strait Islander reference. So the brand Deadly Choices, it's been around about 13, 14 years now. And as I said before, it came from the community. I think there were a couple of guys at the time, Karen Lander and Ian Lacey, not health professionals, they're football players. And we had a student at the time who was doing a student placement who worked with those guys to shape up what is now known as Deadly Choices. But it came from some ideas and concepts that those guys had at the time in terms of how do we engage community in a positive conversation, not a deficit-based conversation. So it was really came from that. It's absolutely founded in our ways, and we talk about our ways in the institute, but founded off cultural values, strength-based approach. So we're not about closing the gap. Yes, it might be a national policy initiative and language that is used, but we're certainly not about closing the gap. I'm not a gap that needs to be closed. I'm a person that needs to be supported. We need to support people to take control of their lives, to make good choices, and to unleash the potential that individuals and families have within their own sort of areas. So we really try to be very focused around that. We really try to have some really clear and consistent messages over time. I think we've demonstrated that over a long period of time now. And we do use incentives. So we do try to incentivise people to make really good choices. So whether that be through experiences, through a shirt, and through mechanisms, which I'll discuss as we go forward a bit. So how do we aim to change behaviour? And I'll talk a little bit about some of these elements as we move on, but we absolutely have some campaigns. We have partnerships with many sporting clubs, Brisbane Broncos, the Dolphins, Brisbane Lions, South Sydney Rabbitohs is the more recent one. So we have these partnerships that absolutely support us in our endeavours. We use ambassadors, which I'll talk about, community events, and I'll give some insight in terms of the engagement and what that's been. I guess one of the core pillars for us is our educational programs where we go and speak to young kids, particularly in schools or other environments, where we talk about healthy lifestyles or tobacco or vaping now. Absolutely rewarding behaviour, merchandise and social media. So it's sort of the core areas that in terms of, and when I sort of reflect on the title of the presentation today, because it is absolutely more than a shirt. People might see the shirt, and hopefully you guys see the shirt out and about there. I know certainly when I do, I go travelling somewhere, you'll see a random Deadly Choices shirt, which is great because, at some point, someone has engaged with the health system to get that shirt. But I think that's the most visible aspect of Deadly Choices, but there's certainly a sort of a much more complex system behind that actually goes into what DC is. So as I said, there's been 14 years. It started off with one healthy lifestyle officer and one tobacco coordinator. Many years ago, there was an establishment of a pilot program, one of the high schools and schools here in Brisbane. It was really founded around identity and culture. So as a young people, supporting them in their journey in terms of who they are as a young Aboriginal Torres Strait Islander person, supporting them in their own journey. But one of the things we did try to do early on was to engage lots of young people to provide that peer-to-peer support. So it's not about middle-aged person like myself coming to talk to young people. It's about how do we engage young people to talk to young people, because they can relate on their own levels that is much difficult for other sort of age groups. And absolutely starting the conversation about positivity and positive language. So where we are at the moment is that we fund directly 14 services across Queensland, so community-controlled health services to deliver deadly choices on our behalf. We don't deliver directly. We fund and contract services to do that on our behalf. We also contract for services to deliver tackling Indigenous smoking. So all up, we have 18 services that deliver on our behalf. When they are in urban, regional and remote locations, and that equates to about 70 staff that we contract through our contract arrangements. Internally have about 20-25 staff, depending on vacancies, that we use then to support our services. So probably need to provide a little bit of an update on this one, but you can see that we've got services based in Cunnamulla, southwest, right up to Normanton in the northwest, with a lot of services then along the eastern seaboard. So Mareeba, we're going to service in Mareeba, Innisfail, Townsville, Mackay, right down to the southeast Queensland corner. So we've got services all over, different sizes, different levels of capabilities, different capacities in terms of their own clinical service delivery, others, community-based programs. So very different in their makeups, but certainly all community-controlled health services that we're working with. And I should have made it really clear at the start that Deadly Choices is about working with the community control sector. So we don't fund general private practices to run this program. It's about supporting the sector to deliver services to the community. Our funding model is that we receive essentially two buckets of money, one through Health and Wellbeing Queensland. They fund our healthy lifestyle initiatives, and the other is through the federal government, and they fund our Tackling Indigenous Smoking initiative. So together, we put those together because you can't talk about healthy lifestyles without talking about tobacco, because it's one of the biggest risk factors in terms of excess mortality and morbidity. So together, we use the two funding streams to put Deadly Choices together. So I guess, as I said before, one of the fundamental pillars is our program. So we do 9 programs. So we do junior and senior healthy lifestyle programs, and really the junior is sort of primary school and senior is the secondary school. And the content's shaped a bit differently. It's pitched a bit differently. We use different sort of mechanisms to tell the stories, and so there's some just contextually they're a bit different, but fundamentally we're talking to children about making good choices, about eating well, exercising regularly, and not taking up smoking or giving up the smokes. We do junior and senior tobacco education, similar structures, and Good Quick Tougher is a nutrition-based program as well. So we do like to talk about kids about making good, healthy choices when it comes to nutrition. Senior Indigenous games, where we get our elders together to do games essentially, where we'll do low impact games, but really important to get our elders together in terms of connecting, yarning. They are super competitive. We just had some event last week where we had teams coming all over southeast Queensland, and also some teams from southwest Queensland come in. Big gathering of elders coming together, reconnecting, but underpinning all that is a really important message about making good choices, whether you're a 15-year-old young person or a 65-year-old elder, still underpinning our fundamental messages. DC Fit is a program that we've had around trying to increase physical activity and fitness, and then we do some work around traditional Indigenous games as well. So this year to date, we've done some of our numbers, 537 programs. So they could be discrete programs, whether they're in Brisbane at Mitchelton High School or Townsville, Kerwin State High School or Kerwin Primary School. So we will collate these through our teams. We have a centralised data portal where they will input data. Luke, here is one of our team members, will collate that and we'll analyse that across the spectrum. But you can see right through the over nearly 7,000 program participants this year, people going through the program. Of that, we've converted nearly a third of that into health checks. then not everyone will be eligible. They might have had their health check before then, so it's sort of the eligibility will affect that number. But from our perspective, it's great to be talking to people about information and helping to build health literacy and understanding of. But it's also really important that we get to see some action and some conversion, that people are going to get their health check or 715, which is the Medicare number that's often referred to. But that is a really important part of what we do, is convert people from information to action. Community events, which I'll talk about, we engage people about tobacco surveys to understand what knowledge and understanding of tobacco and that looks like. Including vaping nowadays, which is a hugely growing issue. We'll get people in terms of pledges to say, look, okay, maybe it's time that, in that behaviour change cycle, maybe it's that time that I make a step to quit smoking. So we sign up for pledges, whether maybe individually or to think about how could their household become smoke-free. Quit line referrals and also tobacco champion referrals. We do, with each of our programs, whether it be in a school or a community-based program, we do pre and post surveys and use self-reported data. So we do want to ask people about before and post the program. What is it? Are you confident in being a leader? As a young person, what does it take to become a leader? How do you feel about that? We ask them questions like that. How confident are you living a healthy lifestyle? And then what does a healthy and positive relationship look like? We talk to young people about what does positive relationships look like. It's not always just about, really health, eat this, eat that. It's broader concept of health and wellbeing, which is really important. So you can see that there's some really good increases, whether they're statistically significant or not. We'll leave that for another conversation. But, first and foremost for us is to really have a good conversation, and that our community members and particularly young people feel like they are taking their own steps forward in terms of their own personal development and growth. We also then ask other questions about, intake of fruit, income, soft drink, and you can see some increases there as well. And I think the last one on the right there is that, our team has sort of conveyed to me that, the pride in themselves and their cultural identity, is particularly as young people, where they might have an Indigenous parent and a non-Indigenous parent, and finding their own way in terms of how they identify, and is really important. It's very individual, but one of the things that we do get reported to us is that people feeling the ability and their pride in who they are and where they've come from, which is really, really important. I think the other bit, I think this is the last bit, is that, just trying to capture who we're talking to. And I think, as you can see, as we move out of that southeast corner into central North Queensland and further north, we're absolutely talking to the right people that are in the low socioeconomic groups. So making sure that we're having the right conversations with the right people, because there's lots of evidence around, socioeconomic status relates to health outcomes. So the fact that we're talking to, in far north and northwest Queensland, 81% of our cohort, the lowest 2 quintiles, is really important for us, so that we know that we're targeting those right people and we can get some of those messages out to community. So that's the programs. I'm just going to talk a little bit about our community and sporting events. So we do lots of events, outside of, yes, going to schools and community events. The other way that we want to engage our community is through sporting events. We know that that's really popular. So we do have a number of events, and I think importantly that when we do host from IUE, that our events are tobacco, alcohol and sugar-free. We have one of our largest events is the Queensland Murray Carnival, that we hold on an annual basis with the Arthur Beetson Foundation and other sponsors. It will draw in over 2,000 participants, but close to 10,000 people over the course of the event. That event is 100% sugar-free. All the vendors must adhere to the guidelines that we set. It's part of the commercial agreement. It's part of the setup of the event. And I'm not sure that you have many other large-scale in Aboriginal and Torres Strait Islander events across the country that would be totally sugar-free. In that event as well, we will sit down with some of the teenagers, and before they take the field, we'll do some sessions around making healthy choices and just reaffirming some of the really core messages. One of the other things there is that every player, we say must get a health check, but I don't think we get to 100%, but we want every player to get a health check before they take the field. So yes, we're talking to young people through schools, we're trying to convert people to get health checks. One of our other big strategies is to hold events like this, whether we can get people to come and engage in something that they really love and enjoy doing. They can do it with family, they can do it with friends, but 100% being underpinned once again by our core messaging and core action around health checks. So 23-24, you can see we'll do different types of events, from Women's Netball Carnival, Men's Golf Day, the Queensland Murray Carnival, which I mentioned, right through a Touch Carnival. I think we held that in November this year, and Seniors Games. So, probably getting close to over 4,000 participants at events. These are probably our largest scale events. Our teams will hold their own localised events, so you can probably add some more numbers onto that. But for our large scale regional events, it's fantastic to see that we're getting people re-engaging. We certainly saw, obviously through COVID, this got heavily impacted. We weren't able to do events, but what we're seeing right now is a huge re-engagement with our events. So at this point in time, massive re-engagement of our events. But, once again, trying to make sure that those events are 100% aligned to our core fundamental smoke-free, alcohol-free and sugar-free as much as possible from sugar. I think the other bit with our partners with our sports clubs, so you can see the jersey which Ezra is wearing there with Deadly Choices logo. So we partner with a whole bunch of sporting clubs. Broncos is one of them. Gold Coast Titans, North Queensland Cowboys, the Dolphins, South Sydney. We've partnered with the NRL directly. But what it provides us is an opportunity to leverage massive sporting brands, which is well beyond the scope of a community-controlled organisation. So we'll partner under a commercial agreement that is funded by the state government to leverage the power of sport for our people. So we can get ambassadors like Ezra Mam. We can provide an opportunity for that young person there to run out. But that young person probably went through one of our programs. So they had to do something to get that experience. We weren't just finding people, that we actually provided an opportunity for that person that hopefully they look back and think, well, that was something that I want to do, change their trajectory, support their trajectory in terms of making good choices. And yeah, so we partner with a lot of clubs to do this work. Pretty apt at the moment. We're going through a state of origin, but we also partner with Queensland Rugby League. So the ability to work with those players and the organisation, to have those deadly shirts, and we can then position some of those shirts at different times of the year. So we can say, for instance, people might want to get a Broncos shirt, but I really want to get that Deadly Maroon shirt. So I'm going to think about when I'm going to engage in terms of how I go to get my 715 at my health check. So we'll try to structure some of these things at different times of the year that helps people in terms of their engagement with their local primary care service or their community-controlled health service. And this one here, we can see that, we know that for 2023, we did 10,000 Broncos health checks were produced. We know that a large majority of those will go to health checks. services might they use them for other types of incentives. But once again, they're engaging with the health service, whether it be a flu vaccination or a health check. The most important thing for us is that there's an engagement with the health service to be engaged, and then that they're getting whichever shirt they want. We've got about 115, well, I think at the moment it's probably close to 125,000 people engaged in our Facebook. I think Instagram's, close to, I think it's close to 30 at the moment. So large audience that we can start to pitch messaging to, but then also leveraging our partners, which have larger audiences again. So, over 1 million followers with some of our bigger clubs that we can actually leverage and get a message out to a massive audience that is positive, that is, we don't see lots of campaigns for Aboriginal and Torres Strait Islander people in mainstream media. So we're able to get in spaces that, for community controlled organisations, an Aboriginal and Torres Strait Islander health message is not common ground sort of thing. So if I look back at this jersey here, when Ezra is running out here, gift us this opportunity to be on the front of the jersey. So we work closely with a whole bunch of commercial partners, and this is one of the spaces that we're really trying to grow. But we certainly work with Kia, and a conversation was had, look, Deadly Choices, we've been working with the Broncos. Kia, you're the principal sponsor of the Broncos. How can we work together? And through goodwill, an agreement that Kia have agreed for us for once a year that we'll get front of jersey for the Brisbane Broncos for the Deadly Choices round, which is coming up, I think, on July 13th or 12th versus the St George Dragons here in Brisbane. The team will run out with the jersey with Deadly Choices. Now, from a commercial perspective, that's, highly sort of valuable, but, through our relationships, through the value, the Kia see in the work that we do and the ability to leverage other sponsors and partnerships that has been provided to us, which is fantastic. No other club, no other Aboriginal and Torres Strait Islander organisation in the country is able to do that work. But, seeing the power and the work that we're trying to do and the value, I think it's been, great outcome. So, we're trying to work with some of our other partners. We've just had a large corporate touch day with Deloitte, where we had, I think, what was it, 160 players from different corporate entities across Brisbane. If you guys want to put a touch team in next year, more than welcome to. But all the funds raised on that day go back into Deadly Choices. And what we're doing this year is we're going to bring a bunch of kids down from the Torres Strait to run out on Deadly Choices round. So we put that back into trying to help create opportunities for our communities. So, a bunch of corporates come and play touch football, the Broncos facilities, a few ambassadors came along, a few of the players came along. But once again, drawing on the strength of the partnerships that this brand has been able to leverage over many years. Ambassadors can't get many higher than Paddy Mills, really. So Paddy reached out to us because, once again, of some of the work that we're doing with Broncos. And I don't just talk about the Broncos. We have many other valued partners. But the reality is that Paddy reached out to us, saw the work that we're doing across the community and wanted to do something with the Boomers. So he was back last year. I think we were able to pull something together very quickly. And once again, we had this singlet in services. So if you go and get your health check, you can get a Deadly Boomers singlet. This was really popular with our younger people, obviously. But, someone like Paddy Mills, global superstar, talking about the work that we do is really, really positive. So we have a bunch of ambassadors on board. Paddy, we've got Steve Renoff, Petro Sivanasiva, even though he's Fijian heritage, he's not Aboriginal or Torres Strait Islander, he's very much looked at by our community as a legend of rugby league games and, someone who's lived and proven to be a great ambassador. We've got Talika Clancy, who will be in the Olympics, Paris Olympics this year, playing beach volleyball, silver medalist at the previous Olympics. Brendan Wakeling has been to Commonwealth Games, I think, weightlifter. Bo de la Cruz played touch football for so many. Tyrone Roberts, Willie Tonga, lots of ambassadors that people can connect with. It starts a conversation. We can take our ambassadors to a community. Hey, I want to get a photo, I want to get an autograph, but it facilitates a conversation. It absolutely does. It facilitates a yarn with some men down the river having a fish, or it's someone at the touch footy grounds, or an auntie at the clinic. But it absolutely facilitates a conversation that which our local teams then can try to capitalise on, that we can try to capitalise on. Then we have a whole bunch of merchandise, which is where the shirts come in, but we have other, like in this picture, we've got onesies, we've got a whole bunch of other scarves, hoodies, shirts, water bottles, bags, you name it, which we can also use the branding from those clubs. So we can put, so Deadly Cowboys backpack, for kids in North Queensland that they want to get a Deadly Choices with a Cowboys logo or somewhere else. We can facilitate that. So, and these are absolutely not for purchase. So we've had many requests over many years about how can we purchase a Deadly Choices shirt. They are not for sale. They never will be for sale. They are about trying to incentivise community to undertake their own steps in terms of healthcare. So yeah, there you go. There's some onesies that we will use for bubs to either come and get their child health checks, vaccinations, or whatever it may be. These are young fellas from the Junior Murray Carnival last year. We won't mention that brand on the front there, but this is Elders Games. So Steve Renoff, league legend, but also sitting down and engaging with those elders at those games and just providing that opportunity. It's been, I think Elders Games are probably one of the best because there's such great interaction. So these are some of our partners, and there are more, but we work with some of these partners. So recently we brought on the Australian Open, where we take community members on a trip to the Australian Open, but you have to got your health check to go into the draw to receive that prize. Like I think a couple of years ago, we took a couple of ladies from Cunnamulla. Had never been on a plane, never been to Melbourne. It was the best experience, but they got that experience because they got a health check. All they had to do is engage with their local primary healthcare service. We'll then try to stitch up the other elements, the funding, the support from our partners, the ability to do that, but to reward people for positive steps in their own health. Done some work around some Olympic testing, as we move to the 2032 Olympics here in Brisbane. Queensland Academy of Sport and trying to go through this big talent ID process. Well, let's go out and talent ID some Aboriginal and Torres Strait Islander kids in remote communities that may not have got that opportunity. I think we got in Townsville last year, we got a guy who set all sorts of records for a 40-metre run. And it was one of our highest rating posts on Facebook for the whole year because we just profiled this young fella who ran like the wind, and massive engagement on Facebook around that post. We also do campaigns. So we talked about access to primary care services. We've talked about events. We've talked about partners, but we also want to have that messaging to our community. So last year we did a campaign, our first around vapes. So ditching the vapes. We know it's a massive growing issue across the whole of the community. But we wanted to make sure that we had some targeted and direct messaging to our community around vapes. So we worked with Wayne Blair, who's the director of Sapphire Movies and involved in Redfern Now, proclaimed Aboriginal director to help us do some of this stuff and did some of our early work with Deadly Choices. So Wayne helped us pull together some television commercials, and then we do some fixed assets. Here's the mock-up of our health check campaign that we did last year with Ezra and Edric, cousins, but also grandsons of our patron Auntie Pam Man. Yeah, so long connection to the program. So hopefully you might have seen some of these on buses around Brisbane. So we will place these on buses in Brisbane, but also, say for instance, in Toowoomba, where one of our new tackling. So we will embed bus routes go, and we'll place these so that in those places that are doing the programs, we'll actually have some other fixed assets or buses placed in those communities. Excuse me, Talisha Harden, captain of the Cowboys NRL side. This year was our first year with the NRL, so we had this shirt, which is the same design as the playing jersey. Now, not everyone can afford $170 for a playing jersey with deadly choices, but you can if you go and get a health check. It's for free, you know. So trying to think about the way that we market, engage, and work in this space is really important. But so far this year, this shirt has been the most popular that we've got. So it's one game, but I think the figures are over 12,000 people for one specific game. It's not the whole year compared to Rabbitohs or Cowboys. It's just one game, but it's been absolutely our most popular. Hammer, legend. But yeah, you can just use the code there and just, okay, where's my local health check, book in, bang, and you can make some bookings online. So absolutely a big part of what we do in terms of there's partnerships and then campaigns. And this year we'll certainly be looking to do some work around health checks. We've just been funded to do some works, particularly in smoking and pregnancy. We know that it continue to be higher rates than we want to see in our women smoking pregnancy. And vaping, we've just been funded for a further 3 years to do a whole bunch of work in vaping. So very keen to do some work in there. But we do place on mainstream TV, Channel 9. Last couple of years, we've sort of placed our TVCs around the football finals towards the August, September time of the year. We know that it's going to get a high numbers of viewers, and we place those TVCs in there. Bus backs, as I said, billboards and other fixed assets, and social media. So we know that, you know, Facebook, Instagram, TikTok, we've been trying to move into that space, but even, you know, onto YouTube, you know, when you have your ads on YouTube and kids are playing or watching YouTube. I know my kids spend Mr. Beast or whoever they're watching, but there is, you know, those ads, and that's our ads. We can start to branch out a bit more in terms of how we try to capture audiences and our mob watching whatever they're watching. I think this is my final slide. So what's next for us? You know, absolutely continuing to support communities across Queensland through the work that we do, but we've also got to be continually to try to improve what we do. So reviewing our content. There's a lot of content that goes into our healthy lifestyle programs, our tobacco programs, our vaping content. We need to ensure that it's evidence-based, it's relevant. The way we pitch ourselves, the way we, you know, try to engage young people remains relevant. We've got a workforce that is ever changing. The workforce environment is much more challenging these days in terms of cost of living, you know, the whole financial components around how we structure our contracts. We need to absolutely be working in that space. Our partnership environment is probably one of our high growth areas. We get lots of requests from people to say, hey, can we do some work with Deadly Choices? Hey, can we do this? So it's absolutely an area that we're continuing to try to work in, but mature that and try to have some more sophistication around how we do that, but not losing our roots of where we came from and why we're here. And I think the other bit, we did do an evaluation about 8 years ago, so it's very timely now that we do that again in terms of the impact of the program for community members, the impact of our sporting partnerships, and having a broad look at what the impact of the program is to inform our advocacy strategies. You know, we've got to continue to advocate for the program that we do, the outcomes that we can demonstrate, and ultimately for good health outcomes for our community. So, and so in trying to, our advocacy strategy is investment in the program. As I said before, we're trying to grow new strategies and revenue streams to support the work that we do on the ground. So yeah, that's the end of the formal slides. Happy to take any questions, whether in the room or online. Hopefully it gave you a bit of a snapshot. There's a lot of deadly choices. I hope you can appreciate now that yes, we've got the shirts, but there are various other streams that inform the work that we do across the spectrum of deadly choices.
Fantastic, thanks. Dallas, anyone have any questions? I've got one. But you know that I think you said it's rolled out in 14 communities or
Yeah, we work with 14 services.
14 services, yeah.
Contracted. Yep.
Yeah. So is the model sort of like there's standard component to deadly choices, but they sort of all have to tailor it to their own circumstances, or how does that work?
Yeah, so it's a really good question. So we've got a standard program that we would run with.
Yeah.
So we will train up. Each service will have their own staff that are employed, and we'll do our own facilitated training to support them in terms of their facilitation skills. But we do have a standardised program.
Yeah.
But absolutely, there's a great opportunity to tweak that for your community in terms of, okay, there might be, different ways, different sort of, but we don't, some of the content remains the same, but how you do that, how you do that in your own local community, what's the context of your community, that is absolutely, at the discretion of those services.
Yeah, and I mean, even that in itself is a really sophisticated way to run a program, because there is pretty good evidence that the more you tailor, any individual, the use of medications or at this level, like working across the whole community, tailoring the messaging and the way you deliver the intervention is more effective than standardised things. So that's really impressive.
Yeah, so your teams I think that's the value of the network, is that it's not a pushed out model. There's a network. We have a governance model where we have all the CEOs come together quarterly. We'll talk about the performance of the program. We'll talk about key issues, and from a strategic level in terms of how we're performing and what do we need to keep an eye on. And then we'll have regional meetings where all the coordinators of the teams will come together. So we do have a structure, a governance structure within the program as well to do that. So good example of that is this year we're going to do our first event with PBR, professional bull riders, because we know that in North Queensland rodeo is so popular, outback and mob up that way, even down this way, I love rodeo. So we're going to do an event with the PBR because that's what community up there like. Yeah. That's what gets them to the table. So we're going to do an event this year, our first one with PBR in Cairns. And we'll have community coming from Normanton, Cairns, Mareeba, all around to engage in that event. So we're continually trying to think about, what are the things that resonate with mob in those areas, and how can we get that? Yeah.
Amazing. Any other questions?
Yeah, I've got one. Oh, down the back there. But you sure? Thanks. Dallas, just move your chair back a bit, right back, please. And this is for folks online as well. Just as Dallas was going through his slides, what if you were reflecting on similarities between what he was saying and what you do? I'll take 3 answers. One from that side, one from down the back, and one from this side. And you've seen me, and one online there too, actually, that's cool. I mean, you weren't just sitting here watching the slideshow, or were you? No.
To be Annie Mary, I was doing a bit of reflecting because I was working on the Young Deadly Free campaign. previously, not
Yes.
anymore, but just seeing how much traction this program got, it's like, we can replicate something similar. I just have to put in the effort and think about it a bit more.
My brain was just boggling with the logistics. How do you work out the demand for jerseys and getting production and having them available? And that's where.
Yeah, look, it's a really, I think that's where we're at. You know, Better Choice started as this community program. It's still a community program, but it's got a lot more scale to it. So we have to evolve as an organisation, as a program, in terms of our systems, our processes, our approaches, our people. You know, it does need to evolve because you know, the environment has changed around us. The school environment has changed around us. We need to be in that space to future-proof the future of Deadly Choices. So that's exactly where we're at the moment because, you know, I think the volume of shirts last year that we work with, so we work with Struddies as our producer of shirts. I think there was over 100,000 shirts produced last year. So we've got to get the designs for every shirt. We've got to go through every club to sign off a design shirt. We've got to get a portal set up online that shirts people can order from. We've got to reconcile that. There's got to be commercial agreements in place for various things. Then you've got services happening on the ground. You've got events that we're running. It is fast moving space, absolutely. But it's a privilege, yeah.
You ever sleep?
On the plane this afternoon.
Sorry, just thanks.
Sorry,
guys.
I'm here.
You're right. Down in the back. The work you do, reflecting on what you heard to, reflecting on the work that you do, because you're working with communities. Nothing. What do you do? Yeah. All right.
Oh, I'm not down the back. I'm on
No.
Because I see that reflecting the size the program's got over the years, and that's such a strong connection to community, led like with PBR, like led by what the community, and never losing that in the research. And I think that's what for me was reflecting there, like
Yeah.
no matter how big and good you get,
Yes.
that's the important.
Yeah, being grounded.
Yeah.
Yeah.
Power of community.
Yeah. Community or ground away. Down back. Yeah.
I'm really impressed with what you guys are doing. The other day, Roxanne and I were chatting about people who doesn't matter what health system is doing, but if people don't access the health system, then it's not useful for them at all. So I'm just thinking, if you have done 100,000 shirts last year, I'm just assuming you have about 100,000 people who would access health services otherwise without.
Yeah.
So it's very impressive. It's something that people who do research focusing on the health system never be able to do something to help people to use the system.
Yeah.
Then my question is, you said about the evaluation was done 8 years ago. Are you thinking of doing evaluation soon, and whether people at Poche could work with you in that evaluation?
Yeah, absolutely. We're thinking about that right now. You know, I think in terms of our funding cycles, you know, the growth and evolution of the program, it's timely that we tell our story again. And you know, that is in the form of an evaluation. So we need to get some more up-to-date information and data on the impact of the program. You know, we've been doing all this work with our sporting partners. I think it's timely to tell some stories about that in terms of what that value and that brings to the table. Because at the end of the day, we're funded like many other programs through government, so we've got to demonstrate our effectiveness. So we're definitely thinking about that at the moment, and what that process might look like. Yeah.
Just online there before I hand over to Roxanne. Was there anybody online wanted to make a comment, type a comment, say something?
Someone likes the PBR.
All right, you got it there.
Yeah, PBR, good. Yeah.
Yeah, okay, all right. Thanks, Roxanne. Sorry.
So just following on from that, girls, just anecdotally, what do you see as the impact? Like, like once you access the servers, does engagement stop? Does it continue on? What's the flow
Yeah.
look like? How much difference is it making?
Yeah, look, I think, it's really, so our job is to get people to the clinic. It's the clinic's job then to engage them, but we do anecdotally, we see fairly good flow through. So we measure 715s or health checks. But in the patient journey, if you've got a chronic disease, the next step would be a GP management plan. Then you can get team care arrangements. There's a whole bunch of things that come along with that. I think that's part of our journey next, is to have some more robust systems to actually have more sort of better data that can identify sort of people's journeys through health systems, whether it be through sort of data linkage or whatever it looks like. But to understand some of that a bit better. We do events. The good thing about events is I think now that they become part of a calendar, which is a community calendar, it's not about us. People expect those events to be on. So it just becomes part of the community life. Okay, well, we've got Murray Carnival this year, get the mob together, we're going to get the team in. It doesn't become a health event, it becomes a community event. And I think that's really important. We've got to that stage where people just expect these things to be on. They're part of their own ways of thinking about their year ahead. Yes, it coincides with thinking about when they might get a health check so they can go and play golf. But it becomes bigger than us. And I think that's where we're at the moment, is to tell that story a bit more robustly. We've got lots of data around self-reported knowledges, but we do need to get a bit better at measuring impact. So I think that's part of the next phase for us, is developing a much more sort of sophisticated data collection and reporting strategy.
There was a comment online, Dallas, you might just I'll read it for the people up the back, you might not be able to read it, from Kiara Minto, just saying, such a great program. I'm currently working on an education program, and I really resonated with your comment on converting knowledge to action with the young people that we. It's great to hear about your incentives. Dallas, if you wanted to respond to that.
Yeah, look, it's one that we struggle with because we know that clinics are really busy after COVID, so people are re-engaging with clinics. So at the same time we're going out there, go and get your health check, we've also got to work with our clinical colleagues, because clinics are under the pump. There's more people than ever going back to, particularly in our clinics, this is what we're seeing. So, there's a flow on there, there's an impact. And, some people say, they might growl us and say, we can't get in there for 3 months. Well, it's a good and bad thing. It's good that people are re-engaging with their primary care providers. Yes, I understand that we've got to get a shirt or get your health check to get into this event. But that's part of the challenge for us in an integrated health system, is actually from an engagement program, health promotion program, actually working really closely with our clinical colleagues and try to work on that. Because sometimes, DC can be just, it's you guys just out there doing that. Actually has a real impact in terms of how clinical services and primary care services are delivered every day.
Does MobLink would certainly be complementary or supplementary to, or additional to. So if you get them into the clinic and they are informed about MobLink, pick up the phone. That's also a branch of that initial contact where people are more comfortable, as well, to have some, in times of not being able to get in for 3 months.
Yeah, so MobLink, and I'm not an expert, what I do know is that it was stood up through the COVID period. So as an online opportunity for Mob to connect with people through the COVID period. But what we found is there's been huge demand for MobLink and engagement with it, that service has continued on. But so it's a sort of a online portal where people can connect, and our people connect with them to support their own journeys. I'll leave it there because I wouldn't do it justice, but it's certainly been something that was successful through COVID, but has continued on because people have engaged with that model of care.
I just want to pick up on, so Dana Van, you might know that surname.
Yes,
So Dana's made a really interesting point about your engagement with young people in the Torres Strait. is that been logistically harder or? can you
Oh,
talk
yeah,
more about that?
yeah, absolutely. So, you know, our footprint, as you saw before, one of those slides is, at the moment, it doesn't incorporate the Torres. So we had previously worked with the Torres Health because they're setting up their own community controlled entity on Thursday Island, Torres Health. So primary, up until that, the primary provider of primary care services in Torres Strait has been Queensland Health. So we've been working with Torres Health, same for Punapima in the Cape. And we've got our very first launch in Cohen in mid-July. Where some of Punapima primary healthcare sites are going to take on the shirts. So we're not everywhere. So that's sort of part of the story is where we're in spaces where the community control entity feels like it's the right time to engage with us, the model's going to work. And that's purely at, the discretion of the local provider. So we did some work up in Dana, up in the Torres last year with the QAS mob around the talent ID. So we went up there, supported them, and we worked together to do some talent ID. And it was really good engagement. And we made that commitment at that point in time that we'd come back and try to support those young people. So, probably an ongoing conversation about deadly choices from a broader perspective. But at that point in time, we did some work with the Torres kids and we thought, no, we made that commitment. We're going to try and, we're going to sort of honour that commitment to bring those young people down for the game. And, we've got people like, the Hammer and Ezra who are really passionate about their mob and they want to see that. So we've been trying to do what we can in that space. Yeah.
Any other final thoughts, comments?
I think, Dallas, for me, having worked in a clinical setting as well, that balance of a program in and then the response of the clinic, that's an ongoing challenge when we do health promotion. And, you don't want that person to get disappointed because they can't. And so clever ways of capturing those wait times so the services can leverage that for their capacity building as well. Sort of stuff is
just some really good communication in terms of, okay, we've got this many schools in our books, we've got this many kids, how do we work over the course of the term to schedule people in for health checks so it doesn't just come in a rush. It's sort of building that understanding of our staff members in terms of how clinics operate and building their own skills in terms of that. Yeah, but you're right, it's got to be an ongoing conversation so that we can manage demand. We've got good processes, we've got good communication, and hopefully get that outcome when people aren't left waiting and get disappointed. Yeah.
And it goes hand in hand with research sometimes too, when you're doing models of care type research and then you haven't got the sustainability follow on to.
Yeah, 100%.
Yeah.
I just have another quick question. Looking internationally, are there any other countries that are doing models or programs that kind of use sport as a conduit in the same way that you guys are to incentivize? It just seems like it fits the Australian culture so well.
Yeah.
I'm wondering, is there, looking further abroad, is there anyone doing anything else in other countries that you're interested in?
Yeah, short answer is I don't know. It's we'd like to find out.
I mean, there's just so many like soccer mad countries, and it seems like such a good model here.
Yeah.
Basketball in the US.
Yeah, oh yeah.
Yeah, look, it's a really, I don't know, to be honest. Yeah, I don't know. Yeah.
Leading the way.
All right, well, we might leave it there and if you just join me, clearly Dallas is a very, very busy man, so we really appreciate your time to spend with us today.
He's also come down from Townsville, so he's not Brisbane based.
Yeah, I'm not Brisbane based, so
Appreciate
we've got Kate and Luke here with us today. They're part of the team based at Windsor. Our head office is at Windsor. Townsville, it's good. Bit cooler here.
All right, thank you very much. Okay, so we've just got some lunch upstairs there for whoever's up for that.